Quantum Health describes their team as big-hearted, fast-thinking people who are on a mission to make healthcare simpler, smarter, and more cost-effective. We're going to find out more from the CEO on this episode of Taking Stock.
Quantum Health is the category creator for healthcare navigation, where we supply healthcare navigation for the largest self-insured employers in the country.
I want to talk about your business strategy. What would you say is your strategic focus over the next 3 to 5 years?
Our focus is really around how do we create the best healthcare experience for members, because healthcare is incredibly complex and hard. It's continuing to be complex. Our role is to take that complexity and simplify it for our members and try to create better experiences, more engagement, and drive better clinical and financial outcomes.
Tell me more about your culture and motivation at the company. What inspires you and how do you remain innovative and ahead of the curve?
Culture is everything. So you can feel it when you come into our shop. You can feel how people are warrioring on behalf of our members to get the best out of their best benefits for the members. Try to create that experience that's better, take the scariness out of healthcare for them. So culture is everything. We invest heavily in our warrior culture. It's a big key element. It's probably the piece that doesn't show up on my balance sheet or income statement, but it's the most important part. And then the innovation side of this is how do we take the problems that our clients are seeing in terms of costs and try to drive those cost elements out. So we're constantly working with our clients and thinking on our own, what's the next best thing that can make a difference both from an experience, an engagement, and a financial and clinical outcome.
Can you share some real life examples of some of the work that you're proud of or
Sure.
key milestones that you've achieved?
One of the big key elements is we're seeing in our clients is pharmacy costs have gone up significantly. So you may have seen some things around GLP-1s and specialty meds. I can tell you from a pharmacy trend perspective, that is significantly hitting our clients. And so what we've been able to do is quickly adapt to say our clients need pharmacy navigation. We already manage the pharmacy trend within medical, but this is actually going out that pharmacy cost. And how do we do it in a way that makes it feel better for the member, but also saves the sponsor money at the same time, and then we still get the efficacy of the meds that are needed. So we've actually, within a year, have put together pharmacy navigation where we are going to launch within this upcoming year that service, which will drive better experiences, better financial outcomes, and still get the right kind of clinical outcomes we need. So I'm super excited about that innovation and what we're doing there.
What would you say are the key challenges and opportunities right now that Quantum Health is facing, and how are you overcoming them?
Well, return on investment is a key element. People are very cost conscious, and so they're seeing their healthcare costs go up. And so you've got to be able to drive significant ROI on top of the cost that we're going to bring to the table in terms of what does it cost to put these solutions in. And so that's a real live need of our clients. That's a real live problem for us is quantification of that ROI, driving ROI for each and every client across our book of business. And we look at it and say, if we're not driving a 3 to 5 to 1 ROI, then we're not in the right place for our clients.
How are you addressing sustainability and social responsibility?
Healthcare navigation really is the ultimate in healthcare equity. It's how you bring the same level of quality of services to the frontline workers that the C-suite has. And so how we think about it is how do we create that same kind of experience, whether you are LGBTQ, whether you have different ethnic backgrounds, whether you have different religious backgrounds, how do we bring that personalized experience and make it a manner of bringing that equity to you as a person. So what's tricky for us is we have to know the whole population, but then get it down to the single person and impact the person based off their backgrounds, based off the key elements that will drive the medical outcomes, because it's important to know whether somebody is of an LGBT background or a different religious element. So as you go into those treatment lines, you can get them the right kind of treatment, get them to the right places, keep their benefit costs lower, and really have a better kind of outcome. So fundamentally, health equity and the inclusion pieces and everything around that, the social responsibility pieces, is core fundamental to who we are.
Amazing. Well, thank you so much for joining me on Taking Stock.
Thanks for having me, Trinity. Appreciate it.